It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Bone cancer in dogs. What is it and what to do? Bone cancer in dogs is a serious condition that affects the structure and strength of bones. It tends to be quite aggressive and often spreads to other parts of the body, especially the lungs. It can be incredibly painful and present as sudden lameness, swelling, or even a fracture without major trauma. The most common type is called osteosarcoma. This type of cancer begins in the bone itself, rather than spreading from another part of the body. Osteosarcoma can be very aggressive. It tends to damage the bone where it originates and, unfortunately, often spreads very quickly to other areas, most commonly the lungs and sometimes other bones. Because of this, it is considered a serious and life-threatening condition. While osteosarcoma is by far the most frequently diagnosed, there are other less common types, such as chondrosarcoma, fibrosarcoma, and hemangiosarcoma. These may behave slightly differently and are sometimes less aggressive, but we will focus primarily on osteosarcoma, as it is the most commonly found. Which dogs are at risk? Bone cancer can affect any dog, but certain breeds and types of dogs are at much higher risk. Large and giant breeds are most commonly affected, such as the Great Dane, Rottweiler, Greyhound, Doberman, Irish Wolfhound, and Saint Bernard. It most commonly affects middle-aged and older dogs, usually between 6 and 10 years old. However, it can occasionally occur in younger dogs. Male dogs are more often affected than females. Where does bone cancer typically develop? Osteosarcoma can develop in any bone, but it has certain preferred locations. It tends to affect the bones of the extremities. The classic phrase to remember is, away from the elbow and near the knee, which means it commonly occurs in the distal radius, just above the wrist, in the proximal humerus, near the shoulder, in the distal femur, above the knee, in the proximal tibia, below the knee. It can also develop in the bones of the spine, skull, ribs, or pelvis, but is less common. What are the signs of bone cancer in dogs? Signs of bone cancer can sometimes be subtle at first, making early diagnosis difficult. Common symptoms include the following. Lameness. Often persistent and progressive, and does not improve with rest or pain relief. Swelling. A firm, sometimes painful swelling over the affected bone. Pain. Your dog may flinch, whine, or be reluctant to use the affected paw. Reluctance to exercise. Your dog may be less willing to walk or play. Lethargy. Loss of appetite and weight loss in more advanced cases. Occasionally, the affected bone can become so weakened by the cancer that it fractures. This often causes sudden and severe lameness and constitutes a veterinary emergency. If you notice any of these signs, it is important to have your dog seen by your veterinarian immediately. An early diagnosis can make a big difference in your dog's quality of life and the options available. What treatment options are available for bone cancer in dogs? Unfortunately, because osteosarcoma is such an aggressive cancer, treatment generally aims to prolong the dog's life, ensuring it remains comfortable and enjoys a good quality of life, rather than seeking a cure. Treatment options include surgery, chemotherapy, palliative care. What is the prognosis for dogs with bone cancer? Unfortunately, the prognosis for osteosarcoma is generally poor, but it varies depending on the treatment chosen. With amputation alone, the average survival time is around 4 to 6 months. With amputation and chemotherapy, the average survival time can extend to around 10 to 12 months, and approximately 20% of dogs live more than 2 years. Without treatment, survival time can be only a few weeks to a couple of months, depending on the severity of the disease. Bone cancer in dogs is a serious and aggressive disease, but there are treatment options available that can improve their quality of life and potentially extend the time you spend together. Whether you opt for surgery, chemotherapy, palliative care, or a combination of approaches, your decision will always be made with your dog's best interests in mind. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.